Well, good morning, everyone, and thank you for being here. I want to start out with some welcome news. Yesterday, I mentioned that we would continue our search for facilities that might be needed should the capacity of our great medical system be exceeded. I said that I fully expect that we will find owners who are ready and willing to step up to work with us to do what is best for all Philadelphians. Today, I'm pleased to announce one shining example. We have reached an agreement with Temple University to use the Liacouras Center and other facilities. This will be used to expand our hospital bed capacity if our brick and mortar hospitals are strained by this epidemic. I'm sure all of you have seen the situation just 95 miles north of Philadelphia, New York, where hospitals are struggling mightily. We need to be ready. We are doing everything we can to be ready. Materials and supplies will be moving into the Liacouras Center over the next few days. I sincerely hope we never have to use the supplies or this space, but we will be ready if we do. And our search for other facilities, for quarantine space, for isolation space, and for additional hospital space will go on. I sincerely want to thank Temple President Richard Engert and Board Chair Mitch Morgan and the leadership team of the university for stepping up during our time of need. We're truly Temple proud. They did not hesitate when called, and I am very grateful for their assistance and leadership as we fight this epidemic. So we thank them, and fortunately, there are many others to thank. I'd like to belatedly thank the Holiday Inn Express Midtown, including President Bill McNamara and General Manager Joanne Bogart. As you know, we are leasing that facility for quarantine space for those who are unable to quarantine at home. The McNamara family opened that hotel in 1964 and has continued to own it for the last 55 years. Bill tells us he's doing this because this is a time of great need for our city. Bill McNamara, his family, and his staff are true Philadelphians, and we heartily thank them. Last week, we launched the PHL COVID-19 Fund with the United Way of Greater Philadelphia and Southern New Jersey and the Philadelphia Foundation. Public, philanthropic, and private sectors came together, unified in creating a regional rapid response fund for the region. The fund is designed to complement the work of public health officials and expand the capacity of nonprofit organizations working on the front lines of this pandemic. I am thrilled to report that PHL COVID-19 has, in just 9 days, raised a total of $8.25 million. That's amazing and really a wonderful thing. Most inspiring is that over 700 of you all felt compelled to support your community during this time and have personally donated to this fund, contributing amounts starting at $25 towards a total of $150,000 raised on the website to date. Philanthropy and the corporate sector have also stepped up. This week, the PHL COVID-19 Fund received substantial commitments from Dow Chemical, Jim Gardner, 6ABC News matched by the Disney Company, Janet and John Haas, the Knight Foundation, the Mindy Holman Frank Bideman Fund, the Philadelphia Health Partnership, the Pincus Family Foundation, the Samuel S. Fells Fund, the Barra Foundation, the Scholar Foundation, and the Van Amerigen Foundation. These generous contributions from individuals, families, and organizations truly demonstrate the spirit and capacity of the entire Philadelphia region. Already the fund has received over 300 requests for funding from nonprofits from across every county in the region, including Philadelphia. All requests are being carefully reviewed with the goal of rapidly getting more resources to nonprofits as soon as possible. Again, these funds will go to trusted nonprofits on the front line of this pandemic and whose resources are stretched thin by this challenge. Remember that you can donate by going to phlcovid19fund.org. That's phlcovid19fund.org. It also gives me great pleasure and pride to acknowledge and applaud Aileen and Brian Roberts for their $5 million donation towards the purchase of 50,000 Chromebooks by the Philadelphia School District. The 50,000 new laptops will be distributed with the estimated 40,000 laptops already in school buildings to students and their families. This gift will help level the playing field and ensure all of our students who attend the 220 district-led public schools across Philadelphia have the tools that they need to learn at home. I also want to personally acknowledge Ben Simmons from the Philadelphia 76ers. Today, Ben is using his influence, voice, resources, and compassion to launch the Philly Pledge. The Philly Pledge is amplifying the important message to Philadelphians to come together to help Philadelphians in this unprecedented time. Ben is calling on Philadelphians who are able to support both the PHL COVID-19 Fund and our partner Philabundance. At a time like this, it is important and inspiring to see our city come together, and for celebrities such as Ben using their platforms to deliver messages of unity and generosity towards each other. You can support Ben's efforts by going to the Philly Pledge, to thephillypledge.com. That's thephillypledge.com. So we thank Ben Simmons and all those supporting his efforts. Collectively, Ben and these individual institutions and donors are making a simple statement. We are all Philadelphians, and we need to do what is best for the residents of our city. Ben said it best himself, and I quote, "As a city, we always band together, and no matter how far away we move in this world, Philadelphia is always our home. Through thick and thin, wins and losses, championships or busts, we always come together in a time of need, and we leave no one behind." I'd like to ask Dr. Farley to give us daily.
Thank you very much. I'm going to give you a health update. Start with the key summary here is that we're continuing to see a growth in cases of the coronavirus infection. The testing is available, but on a somewhat limited basis, and that our healthcare system is open and available for anyone who needs it. So more details on that. Since yesterday, we now have 154 new cases of coronavirus infection that have been reported to us in the health department among Philadelphia residents. That brings us to a total of 637 cases since the beginning of the epidemic. That 154 new cases is out of a total of 998 test results that we received today. So the number of tests that we're doing each day is increasing, and that is a sign of our response. We know we want to do more tests, but our testing is still somewhat limited. That 154 new cases is an increase from the 127 cases that we saw yesterday. Of that 637 total, 50 were known to have been hospitalized at one time or another, and 54 are known to be healthcare workers. At this point, we now have cases of this infection in every zip code in the city of Philadelphia, and we will be posting a map on our website soon if people want to see how this is spread across the city. The key message is that this virus is everywhere in Philadelphia. I'm sad to say we have 2 new deaths to report today, one that is confirmed, one that we don't have the final information, so we're calling probable at this point. Both of these are females in their 70s, and both of them had underlying medical conditions. One of those was a resident of a nursing home in which we previously reported we had an outbreak. This really emphasizes the risk to nursing homes and nursing home residents. These are the most vulnerable people in this epidemic right now. The Department of Public Health is working with all the nursing homes in the city to reduce the risk to nursing home residents. It's going to be difficult. We're doing everything we can to protect them. Among them is requiring policies of no visitors. We know many people are not fully happy with that, but this is the most important thing you can do to protect everyone in those nursing homes. We also, I just got this information just shortly ago, we have our first case in an employee of the Department of Corrections. I don't have further details today, but we expect as this infection spreads further that we're going to see this in a wide variety of employees of the city of Philadelphia. Now, an update on testing. Testing continues to be available. We have 23 sites in the greater Philadelphia area. The way to access them is by referral. Contact your healthcare provider about how to get in there. They each have criteria for whom to test. In general, it's healthcare workers or people over the age of 50 who have symptoms. Most of these test results are being sent out to commercial laboratories. There is a delay in turnaround. It takes a while. It's about 5 or 6 days before people are receiving their test result. We do have testing available today at Citizens Bank Park, a drive-through testing site operated by the Department of Public Health with state and federal partners. It's open today from 1 to 6 p.m. It'll be open the same time, Saturday and Sunday, 1 to 6 p.m. Yesterday, the site tested 242 people. If people want to know whether they should get a test, and if so, how to get it, there's guidance on the website. I want to just remind people again of what everyone needs to do to stay safe. We can't say this often enough. If you're not essential at work, stay home, stay away from other people, keep your distance, and wash your hands. Now, if you are sick with fever, it's especially important that you stay away from people, and if you must be out of your home, wear a mask so you don't expose other people to a potential infection. I mentioned yesterday, and I want to repeat today, that there is a great website that the Centers for Disease Control runs called What to Do If You're Sick, and it has something called a self-checker. So if you are sick and you want to know what you ought to do about it, you can go through that and get some advice as to whether you need to seek medical care. In general, if you have symptoms and have a fever but are otherwise feeling fine, you don't need medical care. However, if you're having difficulty breathing, if you're having persistent pain and pressure in the chest, if you or your loved ones feels that the person who's sick is confused or has difficulty arousing that person, or if you or another person is bluish around the lips and face, that's when you need to seek medical care. You can contact your primary care physician or go to a hospital emergency department. Those hospital emergency departments are all open. They're available, accessible to you. They're not overloaded with cases at this point. So everyone who needs it can get medical care. I also want to remind people that those who have been in New York City in the previous 14 days, when they come to Philadelphia, we want you to be particularly vigilant about quarantining yourself, staying away from others for 14 days after your last time in New York City, because the risk in New York City is quite high, and we want to protect the people that you come in contact with here in Philadelphia. And, we've talked a lot about what not to do, and I know this is a tough time for people in Philadelphia, stuck inside, and not many people not employed who were previously employed. So I thought I'd talk a little bit about what to do during this time to maintain your physical and mental health. At some point, we're going to get past all this, and when we do get past all this, we want to be as healthy and capable of doing everything we love doing as we have been before. So here are 4 tips for what you can do during this time period to maintain your physical and mental health. One is to walk, run, or take a bike ride, either by yourself or just with members of your household, so you're not exposing other people, but you're getting exercise. That'll lift your spirits. Second would be to cook a healthy meal. And if you don't know how to cook, now's a good time to learn. There's plenty of opportunity to do that and ways to get on the internet and find out how to do that. Third would be to call or video chat with a friend or a relative. We all need each other right now, and social isolation is a risk factor for physical and mental illness, and so connecting with people will help maintain your health and their health. And the fourth would be to ask someone you know if they need help and provide help if you can do that. You can buy groceries for people, you can help tutor them, their children over the internet, or you can show them how to use apps that they may not know how to use, that you may know how to use on your phone or on your computer. If you're feeling a little blue, nothing makes you feel better than helping another person. And we need to pull together now and help each other. Speaking of helping each other, again, if people want to volunteer in this effort, Medical Reserve Corps is an opportunity to do that. www.phila.gov/MRC. We are interested in clinically trained people as well as non-clinically trained people who want to volunteer in a variety of roles. And our website is www.phila.gov/COVID, COVID. And if people have medical questions, they can contact our 800 number, 800-722-7112. Thanks.
Okay, thank you, Dr. Farley. And we're now going to move to the Q&A portion for members of the media. Oh, excuse me, Joanna is going to provide Spanish language translation of Dr. Farley's comments.
Muy buenas tardes, mi nombre es Joana Otero Cruz, la subdirectora de Servicios Comunitarios en Filadelfia. Voy a compartir la actualización de material en español para la salud hoy día 27. Seguimos viendo aumentar los casos positivos de COVID-19. La tendencia es que sigan aumentando rápidamente. El sistema de atención médica está disponible para todos los que necesiten, independientemente del idioma que hablen, si tiene seguro o no, o de su estatus inmigratorio. Desde ayer a la 1 de la tarde se han confirmado 154 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 637 casos confirmados. Y un empleado de nuestras prisiones ha confirmado positivo. Con mucha tristeza tenemos que reportar el fallecimiento de 2 personas más de COVID-19. Ambas mujeres en sus 70 años con condiciones preexistentes. Una de ellas vivía en un hogar de ancianos. Los hogares de ancianos o nursing homes presentan mucho riesgo y estamos trabajando para reducir los riesgos. El protocolo de no visitantes es muy importante. Las pruebas están disponibles en la mayoría de los hospitales. Las pruebas deben ser aplicadas a personas que tienen síntomas, son trabajadores de salud o tienen más de 50 años. Los resultados son reportados entre 2 y 6 días. Sobre el centro de pruebas en el Citizens Bank Park, hoy está abierto de 1 a 6 de la tarde. Ayer realizaron pruebas en 242 personas. Sabemos que los casos van a aumentar. Todos tenemos que hacer lo necesario para estar sanos. Si no es un empleado esencial, quédese en su casa. Si debe salir a trabajar, les recordamos, mantenga la distancia social de 6 pies, lávese las manos. Si estás enfermo con fiebre o problemas respiratorios, por favor, manténgase lejos de otras personas. Si debe de salir por una emergencia, use una máscara. Si presenta los siguientes síntomas, debe buscar atención médica inmediatamente. Problemas de respirar como la fatiga, dolor o presión en el pecho, confusión o incapacidad de despertar, labios o cara que tornen azules. Si estamos preparados a atender estas emergencias médicas, queremos hacer un breve recordatorio. Si ha viajado a la área metropolitana de Nueva York, les recordamos que guarde cuarentena por 14 días de su visita. ¿Qué puede hacer para mantener su salud física y mental durante este tiempo? Puede salir a caminar, correr, andar en bicicleta. Si lo hace, recuerde mantener la distancia social. Cocine una comida deliciosa para su familia y saludable. Llamen a sus amigos o familia. Pregúntele a sus vecinos o familia si necesitan ayuda. Nada es más, te hace sentir mucho más mejor que ayudar a otras personas. Si quieres ayudar y necesitamos voluntarios. Ingrésese en el sitio web de fila.gov/mrc. No olvide consultar su sitio web para mayor información, fila.gov/COVID. Recuerde que puede también llamar al 311 si tienes preguntas sobre el COVID-19 7 días a la semana de 8 a 8 de la noche. Tenemos servicios de traducción en 100 idiomas, respuestas para preguntas médicas las 24 horas, 7 días a la semana, gratis. Pueden llamar al 1-800-722-7112. Ahora para preguntas.
Okay. Thank you, Joanna. And now we will move to the Q&A portion. Please remember that we have limited time, so please limit your questions to 3 or fewer, and we will do a second round of questions as time permits. For those of you who are logged in today, please use the raise your hand feature. I see many of you already have, and it is found under the participants list. We will unmute you one by one to answer your questions. And the first to be unmuted is Jeff Cole of Fox 29.
Yeah, good afternoon. I'm actually out in front of Citizens Bank Park where there are a lot of folks lined up to be tested today, lots of folks. So questions for Dr. Farley. Dr. Farley, as you look at your numbers and your rise, do you have any sense of when you might in fact be able to sort of break the rise here or break the curve as everybody's talked about? Can you look forward and see where you think that might be actually able to happen?
You know, it's very, very difficult to predict the future here, and I think anybody who's doing that isn't fully acknowledging all the uncertainty we have. I did say when we had a briefing a couple days ago that perhaps, maybe, after we do this for 2 to 4 weeks, we might see signs of the curve starting to slow down. But I want to be very cautious. There's just an enormous amount of uncertainty here.
Also, Dr. Farley, we've talked a lot about supplies and how it is. You've said almost every time you've briefed that it has meant a certain sort of criteria in terms of folks who can be tested. Do you have any sense that there'll be more in the way of PPE and other equipment that would allow you to loosen that criteria and, in fact, even test more folks?
So there are a number of limits that put a limit on who we can test. One is the laboratory testing capacity, another is the kits that we use for collecting the specimen, and a third is the personal protective equipment. I can say all of those are getting better, and all of those eventually will make it so that we can test more people, but they're, it's going to take some time. I can't tell you how long. Eventually we will be able to do that. There are still limits on all three of those.
And finally, you said 2 new deaths today. What's the total death in the city at this point, Don?
3 total.
Thank you.
All right, thank you, Jeff. And next up, we have Laura McChrystal of the Inquirer.
Hi, for the use of the Leocoris Center and the other Temple facilities, I'm wondering how many patients you would anticipate that those facilities could hold, and also how will they be staffed? Where will the healthcare providers come from?
At this point, we expect the initial setup for 250 patients. We expect the need to be far greater than that, and are cautiously optimistic to see additional resources deployed to the site in the future. But I think our goal right now is to make sure that we stand up and get the site moving as we are. For staffing, again, we're cautiously optimistic that we will see staffing come from FEMA, but we also recognize that may not happen, and so we are currently considering our staffing options and about how we make sure we run the site to the best of our ability. I think as we are looking at the strains on the healthcare system as a whole, every hospital is going to have some staffing challenges going forward.
Okay, thank you. I'm wondering for the Holiday Inn site, since that agreement has already been reached, is that already in use as a quarantine site? Are there people quarantined there already?
So it is not fully staffed at this point, but we have, had some quarantine city staff there stay there overnight. But we do expect that site to be fully operational this weekend.
Okay. And one last question, which is probably also for Brian. The correctional department employee who tested positive, can you provide any details about where specifically that person worked, and also whether any inmates who had contact with them are quarantined as a result?
Sure. So we actually, as we were sitting here during Joanna's translation, we were informed that an inmate has also tested positive at our jail. We do have inmates in quarantine. We're not going to go into specifics of how many or at what facility, but know that the prisons are taking every precaution to make sure that both the inmates and their staff are protected. And we continue to work with the courts to bring down the population of our jails. And I'm pleased that the courts have begun to hear emergency petitions and can look forward to their continued partnership as we try to address these issues.
Okay, thank you.
All right, thank you, Laura. Next up is Layla Jones of Billy Penn.
Hi, I have 2 questions. My first one is there going to be, I'm sorry, let me find it. Do you know if residential parking permits that expire at the end of March will be given a deadline extension?
This is the first we've had that question. I don't know, but I assume we'll follow some of the similar regulations of the Parking Authority. And yeah, that, as Brian reminds me, they're only forcing safety violations for parking in front of a hydrant in the crosswalk, and please don't park in front of hydrants.
And my second question is, how much will the city be paying to use Temple's Leocoris Center for extra hospital space?
Nothing. We're very Temple proud.
Thank you.
Great, thank you, Layla. Next up is Nina Feldman of WHYY.
Hello. Dr. Farley, in light of the absence of tests or the limitations of testing, I was just curious, there are a lot of efforts underway for a variety of take-home, do-it-yourself at home type tests. And I just was curious to have you comment on how testing like that could fit into an overall strategy. I know it couldn't necessarily be used diagnostically, but how would it help if it would?
Yeah, the FDA recently said that companies could market tests as much as they want, and there was going to be no federal restriction on that. As a result, there are many companies that are marketing tests that we don't know how good they are. So the Department of Public Health is looking into this and trying to find out whether we can support or not support certain tests. We don't have an answer on that yet, but at the moment, we're not recommending people use those tests because we don't know how accurate they are. Stay tuned for more guidance on that.
Okay, thank you. And then the other question that I had was, you know what? The other question I had was already asked. Thank you. That's it.
Great, thank you, Nina. Next up, Martin Pratt of Philly YBN.
Hey guys, really appreciate the press conference. Hey guys, thanks for the press conference, really appreciate it. One quick question about the computers. One of their parents emailed us today and asked, will there be some kind of social media filter on these computers that go to the kids? They're kind of concerned about kids being, talked to by adults. And is there any kind of GPS that will be on the machines?
Good question. We don't know, and we'll find out and get back to you.
Thank you.
First we've had this asked. Thanks.
You done, Martin?
Yes, I'm good.
All right, thank you. All right, next up, Marco Sereno of PLS Reporter.
Good afternoon. I'm very happy to hear that Temple's gotten involved with the efforts here. I did hear earlier today that there are more cases appearing at Penn Presbyterian Hospital. So I was just curious if there's been any discussions with Dr. Gutman and the Penn leadership on using, maybe the palestra or maybe some of the empty dorms.
I'm sorry, what exactly was the question again?
I was just asking about if there have been any negotiations to use Penn facilities as well, now that Temple's on board with the city.
Yeah, we're talking to every major institution in the city. These are challenging issues to stand up, and really appreciate the partnership of all of our institutions, our universities, and our businesses as we tackle this together as Philadelphia. And we're confident that Penn will be there when we need them. Okay.
And in regards to the plan currently facing the U.S. House of Representatives, is there a known timeline as to, should this pass this weekend, how quickly funds will be dispersed to the city?
We're working through that now. We have a team of people in finance, budget, and government affairs working our way through what the legislation says and when we expect and how much we expect to get and when we expect to get it.
Okay, thank you.
Are you good, Marco?
Yes, sir. Thank you.
All right, here we go. Next up, Manny Smith of CBS 3.
My questions are more follow-ups on the Leah Corr Center. When you guys say other buildings will be used, specifically which buildings are they? And also, what will be the criteria for people who will be added to use that to go in? What type of patients will be allowed to use that facility as opposed to a hospital?
Certainly. So the other buildings is the pavilion, which is catty corner from the Leah Corr Center, and the parking garage as well for staging. On what type of patients, it's a harder question to answer because we're not in that crisis yet, but we imagine that it'll be other non-acute patients that still need medical care and hospital care, but may not be as in dire shape as needing an ICU unit or the like.
They would be like in the main arena space, like in the seating, or these are beds that are strategically placed, or?
So we are working through all of the layout of the site, and we just can't get into that level of detail at this point.
Got you. My last question was about nursing homes and the second death that's involving a nursing home in the city. Could you guys, or maybe Dr. Farley could go into more detail about what precautions nursing homes are being asked to take? And then what number of deaths would require the closure or evacuation of a nursing home?
So just to be clear, we only have one death in a nursing home at this point. The examples of things that we're having nursing homes do is screening of all staff when they come to work for symptoms. And if they've had cases in the nursing home, staff wear personal protective equipment at all times, all staff at all times, so that if they have an illness and are unaware of it, they don't spread the infection to others. And also separating out patients who have a positive test from those who are negative, that's called cohorting, and other ways of reinforcing standard infection control procedures. We haven't talked about closure of nursing homes. I don't think we're at that point yet, and so we don't have any established criteria.
Thank you.
All right, thank you, Manny. Next up, Lauren Make of NBC 10.
Hi. Thanks, all of you. Another follow-up on the Leah Kurris Center. Mayor Kenny said there won't be anything paid to Temple, but will you be absorbing any insurance costs or responsible for will the city be responsible for cleaning or anything like that? And also, how long is the agreement that the city would get to use those facilities?
Sure. So our agreement with Temple is that we will return the facility and into the same shape that we found it, which would certainly include cleaning and any maintenance that we would need to do. I also expect that we'll cover some operating costs if needed as well. As far as timeline, I think Temple understands that the timeline on this is challenging. We honestly don't know if and when we need it. I'd love to say we're not going to need it. I think that's unlikely, but we certainly aren't clear on how long that need will last.
Okay. Yesterday, we heard from the president that he had informed governors across the country that he would be sending out, his administration would be sending out some guidance labeling counties as either low risk, high risk, medium risk. What is that going to mean for the determinations that you make? How will you take that information into consideration when you make determinations about restrictions in Philadelphia, or will you take that information into consideration? And what would your message be to folks in the city who might be confused if there's a discrepancy between what that guidance says and what you say?
We have a lot of data points that we're looking at to determine what the risk of the virus is in Philadelphia. Right now, we would consider ourselves to be high risk. We're going to continue to look at that data, and we'll make our own decisions about the risk of Philadelphia and whether we feel that it's safe to back off on any of these recommendations.
Thank you.
All right, thank you, Lauren. Next up, Chad Pradelli of 6 ABC.
Thanks, guys. I really appreciate it. So I got it now. Sorry. Back to the Leah Kurris Center. Can you talk a little bit, Brian, about what sort of equipment is being placed in there, cots and so forth? Who's providing that equipment, and who's paying for it?
FEMA is, through our good friends at FEMA, is providing equipment. That'll be things like cots and IV tube holders, things like that. Frankly, I don't know exactly what comes in the trailer, but it'll be a temporary facility. There will be tents involved as well, and other medical equipment.
Okay, this question is for Dr. Farley. Dr. Farley, some estimates, and again, they're estimates, say 12,000 Pennsylvanians will require ventilators. Do you have any sense of how many may be required in Philadelphia, and how many are on hand in city hospitals and with the city?
So our best estimate for the city of Philadelphia is 700 ventilators here now. There's tremendous uncertainty as to how many ventilators we will need in the future. It really depends how effective our social distancing is. If this virus were to spread unchecked, we know that we would greatly exceed the number of ventilators we have. But we have taken these social distancing steps, and we're hopeful that we'll see a change in that. And there are steps that we can take, even if we did exceed the ventilators we had, in providing medical support to people who need respiratory treatment.
Can you talk about those steps, please?
Well, there are a number of other devices that, well, let me back up. A ventilator is basically a very high-tech air pump that pumps oxygen into the lungs. There are a number of other devices that can pump oxygen into the lungs. They're not traditionally used as ventilators in intensive care units, but may be used in anesthesia, maybe used in transportation, maybe sometimes used at home. And so we're looking at a range of options so that if there were a shortage of ventilators, we could try those other devices.
Last question. When you're talking about ventilators, have you requested any from the federal government? And does the city make those requests through the Pennsylvania Department of Health, or do you go straight to the federal government, say the Strategic National Stockpile? How does that process play out?
So we make our resource requests to PEMA, who then forward them to FEMA.
Okay. Thank you so much.
Thanks, Chad. Next up, Pat Loeb of KYW.
I'm sorry, this was asked in a previous briefing, but I don't think there was an answer. Have you looked at how much the pension fund has lost as a result of the crashing stock market?
Yeah, our finance folks are tracking it. I mean, as you see, it goes up and down every day. By the end of when we start trailing off with this pandemic, we'll have a better idea as to what the final hit will be on the pension fund. But as my broker says, do not look at your account every day because you'll drive yourself crazy, which I don't because I'm crazy enough. But at the end of this process, we will have a number and we'll figure out what we need to do to continue to move the pension. The pension fund was actually going in a very good direction until this, and we'd like to get back on track for 80% funded by a certain date, but we really don't have any ability to tell you now definitively.
Okay, thank you.
Are you good?
Yes.
Okay. Next up, Michael Donofrio of the Philly Tribune.
Hey all. So first of all, I guess Dr. Farley, could you provide any more information about the two individuals who died from COVID-19? I know you said there were two women in their 70s, underlying health conditions, but anything else about them?
That's all I have about them. And then the first death was a male in his 50s with underlying medical conditions.
All right. And the Department of Prisons employee who tested positive for the coronavirus, is that the city's first employee who has tested positive?
No, that is not the city's first employee. In our briefing yesterday or the day before, we mentioned there were employees of several departments that were positive. This is their first employee of the Department of Corrections.
And do you know how many, can you say how many employees of the city have tested positive?
No.
Is it because you don't have the answer or you're not sharing?
It's the total number of employees. Of the prisons? No, of the city as overall. Yeah, no.
Roughly around 30,000.
No, we're not going to be reporting that. There's a large number of employees in the city of Philadelphia. We expect that a number of them are going to get sick, and so we're not going to continue to track that and report that.
Okay. And then just the Holiday Inn Express in Center City, is that, I guess, Brian, is that what you were referring to earlier? That's going to be opening, what, you said this weekend?
We expect and hope that it'll be open this weekend.
And can you provide any more information about that? How much it's renting for? How many beds?
So I think I had said previously the number of rooms are roughly around 150.
Okay.
I don't have the lease terms on my mind right now, but we can certainly have that conversation and get back to you.
All right, and then if I could just ask one more, any businesses not abiding by the ban? Have you been cracking down on any businesses in the last couple of days? Can you name them?
So we have had L&I inspectors go out to a number of businesses. I'll have a report, I believe, at the end of today with weekly activity. And at this point, inspectors are no longer issuing warnings, but issuing cease and desist orders. But we have generally seen much better compliance over the last week as people understand what the order is and what the expectations are.
And sorry, just as a quick follow-up, have you issued any cease and desist orders yet?
I believe so, but I will have more information later tonight.
Okay. All right, that's, I guess that's all I got.
Yep, and thank you, Mike. Next up is a very patient Jake Bloomgart.
Hey there, guys. So I just have one kind of small question, kind of following up on the construction stories I've been doing. I saw the state put out some guidance yesterday where, they were kind of responding to questions they get a lot. And one of them was, can I complete my residential construction project? And they basically said that yes, if projects are substantially completed, then you can keep working on it kind of beyond the deadline they had last week. So I was kind of wondering how that is going to intersect with the city's Friday deadline of like right now, basically.
Sure.
Yeah.
Sure, thanks, Jake. Last night, we were aware of the state updated its guidance online. We are seeking clarity on that guidance and having our law department review it. Based on our initial review, we believe that the city's guidance can be stricter than the state's guidance, and therefore we would maintain that any residential site should be buttoned up right now.
Okay, great, thank you.
Thank you.
All right, thanks, Jake. And next up is Denise Clay of The Sun.
Hello. My question is, now that there's a site at Temple University at the LaCour Center, that implies that that the virus may be, getting ready to, I guess, take a turn. What I wanted to know is, for people who are, like, say you're in Germantown, is this going to be the closest site to you to get care, or are there any thoughts of doing anything regionally for sections of the city where you may have someone who really is not well enough to travel?
The city of Philadelphia has a large number of hospitals. All those hospitals are going to stay open. They're going to continue to provide care for people. This simply supplements those. This is not the one hospital in Philadelphia. And it's not clear at this point whether this hospital will be used for patients with the coronavirus infection or for other patients. Just simply add the total number of beds in the city. So the entire hospital system in Philadelphia continues to be open and will continue to be open for all Philadelphia residents.
Okay.
And Denise, I do want to touch on the need of the hospital. I think all of the efforts that we are making right now, and that includes quarantine space, isolation space, additional hospital beds, additional ventilators, PPE equipment, all of that is to prepare for what is likely to be a surge in patients. We don't want to be caught flat-footed. We want to be as prepared as possible to deal with a rapid increase of patients. And that is exactly why we're adding hospital beds, and if God willing, we won't need them, but I certainly expect to.
Okay. Now, one more question, quick, Brian. I was watching television last night. I was watching the Rachel Maddow show, something I don't really watch a whole lot, but I caught it last night. And they were talking about how municipalities are literally bidding against each other for the equipment that you need to combat this virus. Now, is that something that does the city have to go out and find its own equipment? Do you do it through the state? And what are you hearing regarding that?
So there's a mixture. We certainly have our logistics folks who are working through their contacts to find as much equipment as possible, but we also are working with our state partners and with PEMA to try and source as much equipment as possible. We've had a number of conversations with the surrounding counties to try and avoid that. I think Tim Boyce, the emergency manager of Delaware County, said it very well this morning in the Inquirer. This is not an illness that has a sense of boundary, and so we're all in this together. I think it is unfortunate that municipalities are being forced to try and find this PPE on its own. We don't have enough resources. We don't have enough ventilators. And I am looking forward and optimistic and hopeful that FEMA and the federal government steps in and provides not just us, but our surrounding counties, the rest of the state, and the rest of the country the resources we need. I had a conversation with my counterparts at large counties across the country. Every county that has a large urban environment are facing the same issues that we are. And so this is not an issue that is isolated to Philadelphia or to Pennsylvania. This is a national issue, and we're going to need national support in order to solve it.
Denise, are you good?
I'm good.
All right, thank you. And this is the last call for questions. I do want to remind everybody that as we put out in the advisory this morning, we will not be doing weekend briefings. We will be issuing press releases on both Saturday and Sunday. Should developments warrant a briefing on a weekend day, we will let you know. But otherwise, we will resume these daily briefings on Monday. And I do not see any more questions, so thank you all for joining us.